Welcome. Today, you'll learn how to administer first aid to someone who has been injured person. As the nurse hurried to the accident scene, she checked to make sure it was safe. She found someone lying on the ground and gently tried to wake them up. When they didn't respond, she called for emergency help and explained what happened. Then, she opened the person's airway and checked if they were breathing. They weren't, so she started CPR with the help of a bystander. They pressed on the person's chest and gave them rescue breaths, repeating the cycle. After a tense while, the person finally started breathing again, just before the paramedics arrived. The nurse felt relieved that they were okay, knowing that her actions had helped save their life. The patient arrived at the hospital for immediate treatment. The person is bleeding. Apply direct pressure to the wound. Grab the sterile dressing. Snap the sterile dressing on the wound. Grab the sterile dressing and place back on the table. Grab the antiseptic wipes to clean the wound. Snap the antiseptic wipes on the wound. Grab the adhesive bandage to protect the wound. Snap on the antiseptic wipes. If a person has a suspected fracture or sprain, it's important to immobilize the injured limb. This can be done by using a splint or sling. Secure the splint in place with a triangular bandage or elastic bandage to prevent further injury. Grab and collide cold pack on the wound to reduce swelling and relieve pain for acute injuries such as sprains or strains. When you're with an injured person waiting for help to arrive, ensure they're in a comfortable position and reassure them calmly that help is on the way. Engage in light conversation to distract and soothe them, encourage deep, slow breaths to help manage discomfort, and keep them updated on the arrival of help. Continuously monitor the person's vital signs, including level of consciousness, breathing, and pulse. Be prepared to provide additional first aid as needed. Document the details of the incident, the actions taken, and the person's response to first aid, then report the incident to the appropriate authorities or healthcare professionals as necessary. This has been an example of a basic first aid simulation. Feel free to restart the simulation or go back to the homepage to try a different experience.